we shall be looking at the World Suicide Prevention Day. Today is September 10th. The United Nations, alongside the International Association of Suicide Prevention, actually agreed on this very day to create awareness and probably reduce the menace of suicide in the society. If you look at the global figure, about 700,000 persons die globally from suicide. That's if you want to break it down. For every 40 seconds, somebody is committing suicide in any parts of the world. But how do we begin to create awareness? How do we begin to checkmate this so we have a reduction in the number? So I have two wonderful ladies, and normally we say gentlemen of the press, but this time I have two wonderful ladies to look at this issue here with us in the studio. I have a Dr. Hazia Adamobiu. She is a professional mental health, family, and addiction therapist, and also the mental health committee chair of RCAM. She'll get to tell us the full meaning of that. Very good morning to you. All right. My far right, I have Rotarian Vunuri Anita Evido. If I get that name correctly, please. Pardon me, Guardian Councillor, District Chair on Mental Health for Rotary International as Districts 9127, right?
Yes.
All right, but let me begin with you. Before we get to the other issue, most persons will feel suicide is an attempt to take your life, or whoever who is depressed or have mental issue. But can you first of all tell us what really suicide is for the layman? Let him understand what suicide actually means.
Well, thank you for having us here. Suicide is a deliberate act. It's an intentional act. It is a planned act to take a life, your life. It is personalized. It is processed to terminate life. That's what it is.
Okay, so you're saying that it's not induced. Sometimes is it induced on an individual, or you just on your own? Because most times I know there are factors that may make one decide to want to take his own life. Are there factors associated to reasons why persons or an individual will want to commit suicide?
Oh yes, there are a lot of predisposing factors that could make a person decide to take their life. But before I come to those predisposing factors, I would like to say that it differs from individual to individual, because the threshold a human being has will be different from that of another person. When you talk about resilience, you know, today we are talking about fuel increase. The way some people are reacting to it is not the way you are reacting to it. That's why you are seated here, well organized and doing your job. Suicide has a lot to do with the failure of the mind. When the mind gets dark, where is the light? It has a lot to do with hopelessness. When you do not see hope for tomorrow, then it happens. The act takes place. It is a permanent solution to a temporary problem, where if you just wait a bit, you might, you know, cross over whatever the predisposing factors are. Now, one of the major predisposing factors is depression. And depression is, associated with a lot of things. Mental health issues, where you begin to have anxiety, fear, doubt, anger, you feel rejected, you feel maligned, you know, it's time for your promotion, you're not being promoted, you know. So there are a lot of predisposing factors. Even family issues, where you see maybe a couple not being able to handle their issues properly, you know. If there is a failure of the mind at that instance, the possibility exists. So there are so many issues that predispose people to.
Okay, let me come to you, Anissa. Are there any signs for you to actually know that somebody is going through depression or has mental health? I know mental health can easily be detected through medical forms, but depression, there are persons who will just locked up themselves somewhere. But how do you begin to notice that, look, this person has a tendency of wanting to attempt suicide? How do you identify that an individual is going through such a situation, and then you begin to counsel them?
Okay, thank you very much for this opportunity. So when you can notice that when you see a person suddenly withdrawing, either withdrawing from the social circle, withdrawing from events, just wanting to be on his own, shuts down all avenues for communication, doesn't want to be around you. You could even hear the person saying, funny things like, I wish I would just go, I wish this day would end. Or all of a sudden the person just, blanks out. You see the person has not just withdrawn, the person doesn't even want to associate with you. The person doesn't take medications. The person doesn't come out on events. The person isn't getting better. I know sometimes they actually give some sort of signs. Sometimes they could drop you some notes. They could give you some, that's why we say try to communicate more with people who all of a sudden begin to withdraw, because there's really a lot going on in their minds. And that's why you see you have to be, as much as possible, non-judgmental. Try to be open. Try to hear what the person is actually going through, because people are going through a lot and they say less because they are scared of what you will think about them. We are in a society where people judge so easily without even listening deeply into what people are going through. So we try to tell people, try to listen. Even when you see that your friend, who, don't just assume that, okay, the person is so busy. The person may just be, thinking of something to do at, a particular time. So reach out to them.
When you look at the rate of suicide, I don't know whether there are age differences or sex, gender peculiarity when it comes to suicide. Who is prone to suicide? The younger ones, the older ones, male or female?
Anyway, the research says from the ages of 15 to 29, they are more prone to suicidal thoughts. You understand? You have them. It's more on those ages. And then for those who feel they've not achieved so much or they are not where they are meant to be, you have from the mid-40s, well, more on 15 to 29. And there's really no sex, gender. It could be the male, it could be the female. It could happen to anybody.
Okay, let me come back to you, doctor. Now, when you notice this, like the signs she mentioned, if you look at the team for the year, I know it's a team that runs for 3 years, and we're talking about communication. For you to be able to communicate. How do you begin to approach someone? Okay, this person is prone to suicide. How do you begin to counsel this person? I know it's one of those issues she talks about, but how do you form that discussion? I can't just walk to someone and say, look, I saw a note, you dropped a note somewhere, and I want to come talk to you. Are there processes that you can be able to get this person before you now take him to the experts that will counsel him properly?
Oh, yes. Yes. You see, family, school, communities, before we even come to government. When you notice the signs we're talking about, especially withdrawal, when you notice someone beginning to give out their things, prized possessions, and whatever else she has mentioned, the first thing you do is to ask. And we often advise that you should not shy away from the word suicide. Say it as it is. If you have seen the sign, any of the signs, ask the question. Hello, dear, or my friend, or my son, what's going on? We saw a lady who came on social media some time back, weeping that she saw the signs, but she did not ask. All you have to do is be bold enough to ask, present it. And if we say ask, then listen. Because some of us ask questions, but we are not ready to listen.
That's true.
Listen to what this person has to say. Give time to hear this person out. Not as the person is trying to explain why I'm even thinking about this, you begin to amputate the person's thoughts. But no, you don't do that. You listen extensively in a non-judgmental manner. Because the parent is likely to say, with all I'm doing for you, you are still thinking about this? And the typical African parent will probably say, well, that's your business. I'm trying my best. Or to the wife, or to the husband. But the approach should be, just be attentive. Then look around. Should there be any identifiable means that the person wants to use? Because a person cannot just come, hold the neck by himself and go, or herself. You're probably going to go by a rope, a metal, some form of substance, you know. So you need to look around this person's vicinity, whether there is anything identifiable that the person could use, and you remove it. Some of us don't even get nosy enough to go into your partner's room or check the children's wardrobes or whatever. So it's important. If you have noticed signs of isolation, signs of not being interested in what you used to be interested in, signs of appetite reduction, signs of weight loss, signs of aggression, because it could play out, you know, differently in different people that were not previously there. You do all this, and then begin to do what we call negotiation. Engage. If you see that you are not succeeding within a period of not more than 1 week, you have to seek help. And if you are a therapist and your client has openly used the word suicide, or I think it's over, or I don't think there is hope for tomorrow,
I can't go on again.
you cannot be confidential about it. You must report it. Our profession is quite confidential. I'm not supposed to share information about what you discuss with me. But when it comes to suicide, you have to break that confidentiality.
Okay, let me go back to Anita, talking about conversation. Just like what she said, you have to be able to start the conversation and then before you seek for help. But there is this trending issues of social media impact on especially the young ones. I don't know, there was an incident that happened recently where 2 siblings from Nigeria were sentenced by a United States court over sex extortion, where they have to put nude pictures of a 17-year-old on the social media as she committed suicide in the US. These are just very few of them that we've been seeing. Now, how do we begin to collate this idea, social media on the other side, and then suicide attempt? How did this, what's the correlation between suicide, social media and these suicide trends?
I usually say social media is powerful. Social media is positive and is also negative. It has its positive influence and it has its negative influence. You know, social media has done, sorry to say, but I think it has done more harm than good in the life of the younger ones. Yes, because they have the access to the internet, they have access to apps, they just go in. And you see, when young ones are troubled, especially the ones that don't want to speak out or are scared, immediately they go on, they just Google. And you see, Google has, oh Jesus, Google has various response for everything. So you see, they just go on Google and just start, what do I do? I'm tired, I can't go on. And then, you know, they start getting some kind of ideas, they start getting information. And you see, when you keep searching, there's something about apps and your search. When you're constantly searching about something, those results keeps popping out.
Yes.
If you keep scrolling on Instagram for some kind of info, you keep seeing more of those information. So the more this teenager is going in and searching for some kind of answers, the more he or she is getting certain information he or she is not meant to be exposed to, and then she keeps seeing it. Or you see, ABC at the age of 18 ended it all because she was tired, and the person is like, okay, why can't I just do this? How do I go about it? How, just like that. And that's why you see we tell parents, in as much as possible, try to make your children very close to you. You see, it's good to be disciplined, but even being disciplined, try to make them your friends. Try and be in control of at least 80% of the activities they do on social media. Before you give a teenager the phone, be sure that at least you have access to what he or she is searching for. Not just that, have an open communication with your child, that your child should be able to, no matter what he or she is going through, tell you what the problem is. Tell you what's the, before a child is thinking of suicide, then you know that really he or she didn't even, communicate enough, or even if she communicated with the parents or friends, they didn't give enough attention to her, and that's why she resorted to social media to look for answers. And you see, most times they get the negative answers they need. But then again, sometimes, we thank God, there are also positive answers to these things. But it depends on what the child decides to do with the information.
Let me stay with you on it. There's other issues I raised where some persons who like kind of blackmail.
Yes.
How do you begin to handle issues like that? I know they do that also on like the nude issue I talked about.
Yeah.
There was recently an incident that happened in Lagos. A banker committed suicide. Then we have the founder of one online marketing platform committed suicide. And when you look at these persons, you tend to wonder, just like the example she made, I'm sitting here right now, I may not have issues or be thinking of challenges or job and all that, but people in that category commit suicide. Now, how do you begin to tell people that, look, someone as rich as the owner of Konga killed himself? Are there hidden factors that people don't know that you feel, okay, this is why, I know she mentioned some of them earlier, this is why this person may have committed a suicide?
That's what I think it's all still the same answer. People are actually, going through a lot, and that's why we still talk about communication. When you see, for instance, some people may feel they've not reached somewhere they want to be, or mental disorder, mental breakdown because of, a lot of psychological effects. Depression. Depression has a lot of, weight on people. Depression, withdrawal, aggression. They just feel, people don't love them so much. People are not listening to them. And then you see this blackmail. When people, and that's why you see, when you see the issues of blackmail, no matter what, please open up, reports, talk to people about it. No matter how bad it is, talk to people about it. So that's why, please, we are pleading. No matter what you are going through, no matter how depressed you are, there must be somebody you should be able to communicate to. You should be able to seek help. Seek help. Go to the hospital, go to the counseling centers, meet with your mental health therapist. Even pastors and priests are trained these days for these issues. When they can no longer handle it, then they refer to the mental health experts. Seek help. And please, we advise family. You see people withdrawing that way. When you see people are all alone, when you see people are so depressed, don't just leave them. Speak to them. Like she was saying, sometimes you may want to, help people by the time you talk to them. Sometimes also talking to them, people are quite pretentious, When they see you are talking to them, they just, hold you along with them. And then after some time, there was a case where a lady, she updated her status that this is the end. She wants to end it all. People started reaching out to her. People called her. She took people all through the period she was with them. Oh, she's okay. Thank you for coming. And then she was like, She needs to relocate. She found a cheaper house. She wants to start all over again. That the cheaper house was where she had already planned to commit suicide, and that was where she ended it all. So even when the person is saying you feel the person is, has gone through, follow up. Don't just leave the person alone. Keep following the person. So you see, family, friends, we have a big role to play in the lives of people around us.
Okay, let me come back to doctor. Do we really have a structure in ground to actually handle instances like this? For instance, Rotary, I know Rotary has always been there providing humanitarian services. Talking about the authorities concerned, how much of government attention have we had in the cases of suicide? I know some advanced countries will tell you that suicide is criminal. You're even arrested for attempting suicide. But coming back home, how much of these government agencies, how much of the attention is being put into this?
Well, thankfully, a lot of attention is coming into it now. Like in Rotary, this month is our month for basic education and literacy. That's why we're even making sure that people get educated on this, enlightened on this particular subject. Now, when you talk about government, we're still working towards it. The Ministry of Health is beginning to invite a lot of NGOs, a lot of professionals to join hands with them to address some of these mental health issues. Thankfully, the mental health bill was passed last year, and we find it a bit slow, in terms of putting it to work, but it will eventually land safely. So since the bill is there, all professionals in that space are going to be able to work together. First, we identify them, make sure they are licensed, make sure they have their practices well organized, and then we start proper work. But for now, for the vulnerable, for those who are, in this act or having the ideation for this act, we have different organizations online, genuinely, certified online, that they can reach out to, who, if you just call and say, this is what I'm thinking of doing, this is what's going on in my mind, people are there to help you, to see you through it, to talk you through it, And I would like to say that the government, again, is, I don't know how they will respond to the financial implications, because mental health issues are meant to be funded. As at last year, from armchair research, we know that the number of psychiatrists alone in Nigeria were no more than 220 for a population of over
2 billion.
You see, so we don't even have enough practitioners, whether as counselors, whether as, I'm talking of professional counselors, whether as mental health therapists, whether as clinical psychologists, whether as psychiatrists, we do not have enough. So I was at a forum speaking yesterday with youth, and I said, look, we can't all be engineers. Let us come and become practitioners in this field. The sky is wide enough for us.
Yeah.
Yeah.
All right, as we wrap up this very discussion, let me go back to you, Anissa. The theme for this year is, or for the year, for the 3 years, is changing the narrative on suicide. How do we begin to get this, like a final thoughts for you? Let's get Nigerians aware that, look, these things are there, and this is what you should do, which are some of the points we've raised so far, so that we'll have a reduction. You cannot erase totally that suicide will stop, but we should have a reduction in the figure. Like I said earlier, 700,000 globally. How do we begin to change the narrative now? We now have a reduction in the numbers as we wrap up this section.
Yes, so we can change the narrative by first creating more awareness, which is what we're already doing. we're trying to create the awareness that, you see, suicide is not the end, but there are other ways we can walk through it. When you seek help, when you seek support, when you go back to your families, your friends, you know, things could get better. We are trying to create hope in the lives of people by also letting them know that there is still a long journey, there is still a long way ahead. It doesn't just end now. Give yourself some time to heal from whatever it is you are going through. With the help of mental health experts, with the help of professional counselors, as she said, with the help of your family, I believe you can pull through. So please, we are telling people, try and seek help. Be open. And we're also begging people, even when they come to you as families or friends, don't shut them down. Give them listening ears. Be attentive to them. Follow them up. Love them. Give them your all. Give them your best. And journey through with them till the end, till they are fit and they are okay.
Can I get your last thoughts, Doctor?
My last thought would be say no to suicide. It is a permanent solution to a temporary problem. And there is help. Speak up. And remember, tomorrow will always be better. Thank you.
All right. I just hope that those listening there will definitely pick one or two from what you've said so far, so that we can be able to save a life. I've been speaking with Dr. Hazia Adamubio. She is a mental health committee chair and also professional mental health, family and addiction therapist. Thank you so much for being on the program.
Thank you, sir.
And I have Anita, if you don't, the guidance counselor, district chair on mental health for Rotary International District 9127. Thank you so much for coming on the show.
Thank you very much for having me.